Okay, so the next question, and this might be something that a lot of students may look at to see whether they're going to go into one profession versus the other, which is, what is your favorite part of your schooling and or work, depending on whether you're in clinicals and stuff yet? And also, what is something that maybe was unexpected or a challenge for you to um, struggle with, maybe, because that might be what makes somebody a good fit or a bad fit for this particular career.
So I think there's two aspects of just enjoying medical school in general. There's the social aspect in that, just meeting people. You've gone through all these levels of education, and as you go, you tend to be surrounded by people who are more like you, who share your values, and they're able to put in the work. So it has been a true pleasure to sit down and grab coffee with my classmates. And they've all got amazing stories. And I have no doubt that with them and with all the people who are eventually healthcare providers, that they're amazing people. And then, so that's my favorite social part. And then intellectually, I love learning about anything, right? So anatomy or like basic science or anything like that. It's fascinating. It's fascinating to me how the body works and how it doesn't work and all these things. And to know that I'm learning all of these things eventually to help serve somebody else. And then just because it is 4 years of fairly intensive education, know that before you go in, because it's long hours. So typical day is classes from 8 to 12. And then it's studying, eating meals, being with your loved ones. And it's you can't have a part-time job or anything else. It is school, only school, and then making sure that you take care of yourself as well, because you have to do that. So.
My favorite part of speech language pathology is definitely the diversity of patients we get to work with. So whether it be traumatic brain injuries, head and neck cancer, children with autism, with cerebral palsy, or right now in the time we're living in, a lot of people are getting trached. So that means that a lot of people need swallowing help. A lot of people need to get back to eating a regular diet. So it's truly really interesting to work with the diversity of patients that we get to work with. And then there's also a lot of flexibility within speech language pathologists. You can work in a hospital, you can work in an outpatient clinic, and the schools, I don't know, the possibilities are truly endless. Something to know about the field of speech language pathology is that it is relatively new. Many people don't know what exactly a speech language pathologist does. So many are under the impression that it is articulation and language, but our scope really goes a lot more further than that. So it does involve a lot of advocacy for us as a speech language pathologist, but as well as for a patient to get referred to us so that they can get the appropriate evaluations that they need and the appropriate help that they need. But also something challenging about speech language pathology is that it is a 2-year program. It's not as long as the other professions, but it is truly, you are invested in your work and you're studying because you do have a lot of material to learn within those 2 years.
Yeah, and then for physical therapy, I would also say that it is quite a bit of work. You kind of have to, I'm just going to start with that part. I'm going to start with what you need to know before you get into school is you have to be committed to continuing to learn. And I think that if you want your learning to sort of stop at, before you get out into practice, physical therapy might not be the greatest because, and I think I can share this for a lot of the other health professions, is that things are always changing with evidence that comes out. And so it's while we're trying to provide the best care, you really have to stay committed to continuing to learn to provide the best care. And then my favorite part is really learning some of the techniques. We have labs where we practice some of these hands-on things and exercises, and how to best progress a patient to help them get stronger to be able to do what they want to do. And I think some of that as well, you practice your communication skills so that you can educate a patient so that they have a better understanding on what's going on with them.
And my favorite part about the OT profession is like how inclusive it is, and also that we consider all of the patient's needs, which includes physical, psychological, social, and environmental. And this would also come with their occupations they want to do and perform. And we just really emphasize how important it is to be client-centered, which is like just doing what they want to. It's like at the end of the day, you know, we do have this, we went to school for this, but if the client doesn't want to do what we think, you know, we should do, then we need to respect their decision and do what they want us to help them with. So I think that's really, I like that aspect of it. And my favorite part about like OT school in itself is like my classmates, my professors, you know, learning from well-rounded professors who just are experts in everything you're learning from. Like, that's so amazing. And something that I find challenging is time management. And I know that's right now in school, but as well, like once I become a practitioner, that's also going to be difficult because, you know, you're trying to balance everything, your social life, you're trying to balance your school life. And I think if I could give any advice, it's like, it's okay to say no when your plate is already super full, and, you know, take some time for self-care. Like, self-care is so important, and I can't stress that enough, because I know that, you know, sometimes I want to like study for 5 hours and, you know, be so productive. And then I just like don't want to do self-care for me because I'm like, no, I can use that time for studying. And then when I do that, I'm not as productive than when I like take 2 hours for me and then 3 hours for studying. Like that's always works way better. So that's just something that I want y'all to know.
So my favorite part of PA school has been starting clinicals. So we started clinicals this month. We just finished our first rotation. And it's been super rewarding taking what you learn in didactic and learning what we've learned from our professors and in clinical skills. You know, we learn intubation and lumbar puncture and all the different techniques that doctors, nurses, you know, everyone learns. We learn those as well. And then being able to apply them in clinic has been really fun, and it's just been super rewarding. Something that has been challenging is the rigor of the program. Like I said before, it's not exactly the same, but it's basically like taking a medical doctorate schooling and smashing it into 2.5 years. We go to class from 8 to 5 every day, plus balancing a social life or not social life, self-care, studying, eating, all the different things. And doing that in 14 months, learning everything you need to know, and then going into clinic has been something that is very challenging. So like Emily said, you don't have time for a job or anything like that. You just have to go for it and get through the school, and then you can go out and practice and figure out what you want to do.
So my favorite part of schooling, I think, is that once you get to nursing school, so your 5th semester, you get to start doing patient care and assessment almost immediately. I know with the med students, for example, they do 2 years and it's pretty much strictly classroom. We are literally hands-on taking care of people from our first day of clinicals. Initially, they start off practicing skills on each other in the simulation labs, but very quickly that becomes actual clinicals where you're working in the hospital. And I think that I love that someone else mentioned patient-centered care is always our focus. And that's very much what nursing is about. I think something to know before you choose this career is the breadth of opportunity that's available to you as a nurse. And one of the coolest things about nursing to me is that none of your experience is wasted. So I can go and become a nurse at a traditional, like a medical floor on a hospital, seeing post-op patients or patients who come in through the ER. And if I decide that's not really for me, then I can go work in hospice care, or I can go be a school nurse, or I can go into research, or I can go into advanced practice. And in advanced practice, I can be a women's health nurse practitioner. I can become a registered nurse anesthetist, or I can become a certified nurse midwife. So there really is so much. There are nurse entrepreneurs. There's so many things that you can do within a nursing career that it is not hard to find a good fit for you.